About a month ago, there was a yellow fever outbreak in Edo State, as confirmed by the Nigeria Center for Disease Control, that led to the preventive campaign, which targets the vaccination of children and adults that's aged 9 months to 44 years. About 6 states of that's 6 states in the north now. Niger, PLATEAU, BORNO, SOKOTO, KEBBI, and of course the Federal Capital Territory. Now, the World Health Organization, in collaboration with the National Primary Health Care Development Agency, started a yellow fever campaign, of course already talked about in Edo State, targeting 3 million people across 13 local government, that's council areas now. On Nigeria Today, our focus is on discussing the reactive yellow fever campaign. What's that about? Well, my guests will do justice to that as we welcome them to the program. My name is Blessing Abu. As with me in the studio to discuss, like I said, the guests are seated already. That's the reactive yellow fever campaign. I'd like to welcome Dr. Tena Nwange. Accelerated Disease Control, that's with World Health Organization. Welcome to the program, sir.
Thank you very much.
Joining him on set is Nena Eze. She's a public health practitioner with the National Primary Health Care Development Agency. Thank you for joining us on the program.
Thank you.
Well, first things first, what is this about a reactive yellow fever? Yes, the outbreak was there, and that same last month when we got that news, we had cause to discuss that on the program here, that's Nigeria Today. So, what is the reactive part of yellow fever campaign, or what exactly is this campaign all about? Dr. Sena.
Okay, thank you very much, Blessing. Now, the vaccination basically is a really very effective tool and strategy for yellow fever prevention. And when we say reactive campaign, we're talking about a campaign which we're doing in response to an area where we have confirmed outbreaks. So in the context of Edo, this is exactly what we're doing. We had an outbreak, like you had alluded to, in Edo State, and this covered a couple of LGAs where they had reported cases, and we're actually targeting to vaccinate all the persons within those areas, about 13 LGAs, where persons between the ages of 9 months and less than 45 years, basically 44 years, will be vaccinated with the yellow fever vaccine. So this is what has started. This is ongoing currently in Edo, and from the feedback we have, the turnout at the camps, at the sites, have been really very impressive. And we're just struggling to get everybody vaccinated.
Why the struggle? Well, perhaps Primary Health will let us know. Is there, what are your own concerns as this outbreak is just rampant, especially now that we have about how many states that are being at least being looked into?
The concern in that we are looking at now is that there are a lot of challenges getting that number of people, that target group, vaccinated.
Why is it difficult?
9 to 44 years, that's a very large number for the vaccinators to cope with. That's the greatest challenge that we are facing, because everybody is afraid and they want to come and be vaccinated, because vaccination is the most effective preventive measure against yellow fever.
Okay, so it's not just because you don't have enough vaccines, but just for the number to cope with. Is that the issue?
Yeah, basically it's not about vaccines. Just to take us back a bit, we were talking about the preventive campaign which were done in 6 states, which had just been concluded, where we're targeting almost 20 million people. It's also good to put this in context. This age cohort is about 85% of the population, so that's everybody literally. So that's a huge chunk. So when we don't have outbreaks, we do a preventive campaign to prevent the outbreaks, and the phase that the campaigns that we just concluded is regarded as a preventive campaign. When you do have an outbreak, the country, the issues around vaccines don't come up because you have what is called the ICG. The ICG is a body which stocks up a certain emergency pile of vaccines, and whenever any country anywhere has that confirmed outbreak, the ICG ensures that you have enough vaccines to push to ensure that that area where you have the outbreak is fully covered. So basically it's not about vaccines. My colleague here has talked about some of the challenges with the number and all of that, but also to put some other interesting context. Like I said, it's not the whole of Edo State where we're vaccinating. We're vaccinating just 13 LGs. Now, because of what people had heard about the outbreak and all that, we've actually had reports where people have moved from LGs where not part of the exactly.
Well, perhaps they're now trying to help your job on the preventive side, actually, and not forgetting that this is a period people move in their numbers exactly in between. So let's take a look at what other things to be done, at least for people to actually help themselves. Now, you've just talked about people who are even in the non-affected local governments. So we use that as a peg for other parts of the country that you're yet to reach. What exactly should people actually watch out for to actually help themselves prevent this spread?
One of the most significant things is that in our time we have what we call long-lasting insecticide treated nets. Once you sleep under long-lasting insecticide treated nets, you have avoided the mosquito bites, and the Aedes mosquito is the culprit for this yellow fever, and it bites mostly during the day. So another thing you have to do, apart from sleeping under it at night, is to ensure that once you are outside your home, you are on long gowns or on trousers, and then wear clothes that cover your hands, and also put on.
What if you target your face?
At least you'll be able to drive that away, and also put on mosquito repellent creams. But you have to be very careful with children and the elderly in that case, and also do what we call vector control. Make sure that there's no stagnant water around your house. Make sure that all stored water in containers are covered. Make sure that no any gutters, the drainages are kept neat, so that wherever mosquitoes are able to breed, you make sure that you stop that multiplication of mosquitoes.
Okay, I know people are well. Okay, it's there for those who. Let's not take it for granted that everybody understands what symptoms to actually watch out for, because sometimes it could present itself like any other fever or something similar. What are those symptoms people should watch out for, even as this campaign is on, part of your awareness?
Okay, so even outside the campaign, for you to be able to detect that you even have an outbreak, you should be able to actually pick out. People must go to facilities, and the people in the facilities must actually suspect. So this is what is called the yellow fever surveillance system. And the yellow fever, it's such a simple. The name of the disease tells you what the disease is. So there's a fever, and there is yellowness of the eyes. Basically, it's as simple as that. So what we're pushing out to all health facilities and to our communities out there is that if you see this cluster of cases, go to the health facilities. Now, the health facilities have been sensitized within a system where every case that comes in that is suspected, actually they report through a chain of systems from the health facility all the way, and that is coordinated by the Nigerian Centers for Disease Control. So these cases, suspected cases, we take blood samples, run a test, and the test tells you, okay, this is a suspected yellow fever case. We have 4 laboratories within that network within the country, and everybody sends samples to those. Once we have a positive case from those labs, we also have a regional confirmatory lab in Institute Pasteur in Dakar, where samples are sent. We confirm that these are actually yellow fever cases. So for us, we are not going to go very complicated. If you have a fever, and also you have a yellowness of the eyes, please go to the health facility and all of that. These for the country, we talk about the eye strategy, and we talk about yellow fever and the eye. The eye there is not the eye physically, but we're actually talking about eliminating yellow fever epidemics. Okay. And this is basically what we're pushing. And sometime in April, the Director General of WHO was in the country, and this global initiative was launched in Abuja. And the aim here clearly is to ensure that we actually eliminate yellow fever epidemics through vaccinating almost everybody in the country. The country's plan is to vaccinate almost 170 or so million people before the year, before the next six or so years. Like we said, it's easy for us to say, oh, vaccinate everybody at once, but that's a really big logistic challenge. So we're doing this in phases, and taking us back to the Edo situation. So the plan, once we finish up in these areas where we had this outbreak, the phase next year is looking at a situation where you have the whole of the state basically, and some of the other states that have been ranked as high risk for yellow fever being vaccinated during this period. So basically that is where we are. So the idea is routine vaccination. We have to ensure that every child within the Nigerian immunization system gets their yellow fever vaccination at 9 months. And within this period that the country has agreed to vaccinate all the people, ensure that everybody comes out to the health facility, to the health posts, and gets vaccinated with the yellow fever vaccine. All
right, gentlemen and first lady, when we return from this break, because we're going on a break now, we'll find out more about what our symptoms are. Yes, we already talked about the yellowness. If there are other things the public needs to know, how free is this? I'm asking that question because I know it's supposed to be free, but somehow today I was able to, well, some news on the net, we're told some parts of the country, especially on this outskirts of FCT, people were being asked to pay even 150 for coming around to come and do whatsoever for yellow fever. And I don't think that's proper for a country that is also looking out for health for the nation and residents, of course. You're watching Nigeria Today, and our focus is on the Reactive Yellow Fever campaign. And we'll be right back after this break.
The Nigerian Television Authority News 24 channel, your dependable all-round news station, offering you world-class news programs, documentaries, spotlights, promos, and information highlights. Take advantage of our network reach and advertise your interest, goods and services with us. NTA News 24, first among equals with digital broadcasting. You can reach us on Channel 21 Terrestrial TV and Channel 101 on the Star Times platform. For more inquiries, please call Henry on 0803 379 0884. Join us today.
Welcome back. If you've just tuned in, the program is Nigeria Today, and our focus is on the Reactive Yellow Fever campaign. I see I have my guest seated. I have Dr. Tina Nwange and also Nena Eze of the Primary Health Care Development Agency. Of course, Dr. Tina is with World Health Organization. Okay, just before the break, I talked about what people need to pay. And I was just sharing that some persons are making people in some parts, especially suburbs, cashing in on people's ignorance, perhaps. So what is the National Primary Healthcare Development Agency doing in this regard to actually get more people aware of what to do and where to find help?
We are already on it, since we are, by God's grace, here in NTA. And we want to let everybody know that vaccination is free in Nigeria. If anybody asks you to pay, no, you are in the wrong place. You are not. Go to every government health facility. It is free.
Okay, so that's free now. Well, I would also ask what other things for people that are wary of being reinfected, if there's anything like that, after taking in their own vaccine, but for some other persons who might be neighbors, family members who are affected, how should such persons prevent or take care of themselves against such occurrences?
You know, the beautiful thing about yellow fever is that you have an absolutely effective tool. The tool here being the vaccine. Once you get vaccinated, you are protected for life.
For life.
For
so
life.
Was this talk about 10 years span?
Yeah, fine. So that's the beautiful thing about science, and it's a very revolving thing. Yeah, a couple of years back, and you have what is called the SAGE group. The SAGE basically is just a group of big intellectuals globally who make recommendations. And prior to now, we had 10 years, but the recommendation clearly, based on the available evidence and recent science, clearly is that once you get vaccinated, one shot protects you for life, and that is what we keep pushing. So for everybody who is out there who hasn't been vaccinated with the vaccine, please, particularly in Edo, we would like to call out for everyone within those LGAs to go out to the designated centers, and also across the country for children that are less than at 9 months. This is where the schedule is. Please take out your children to the vaccination health facilities to get vaccinated. And the country's aim, clearly, like I had said, is that within the next 4-5 years, we will vaccinate everybody. And please, we'd like to call on everybody.
Yeah, you've been saying everybody, but at the same time, from the look of things, we're working around 9 months to 44 years of age. So whatever happens to those who are above 44 till whatever the age or nature permits them to stay, what happens to those groups if they've not been vaccinated?
So the beautiful thing is that everything we'll do is based on data. So we look at our epidemiology, who are the people who are at risk, who are the people that are affected, and things like that. So for the Nigerian context, these are the cohort that we've had the most cases affected. You've had 1 or 2 outliers outside the 45 age group, outside, and all of that. So the country has focused on that age group that has the biggest burden. So the thing is that if these people with the biggest burden are protected, then the virus just remains with the mosquito, and it really has nowhere to go. So we're just, it's a public health decision, and we'll focus on the people who are most vulnerable.
Okay, for this campaign now, Nana, is this reactive yellow fever campaign, is it going to be limited to just Edo, because that's the latest case, or are there other states that you're hitting at as well?
Yes, Anambra State will soon join.
Okay.
Anambra State will soon join, because some cases also were also reported in Anambra State, and they were confirmed, and so very, very soon after the Edo is the next on the list is Anambra State.
Okay. So just, okay.
Yeah, just to add on to that. So we can't have the numbers to who is next. The thing is that the country will respond to any outbreak that happens. So if that outbreak comes up in Anambra, it comes up wherever it is, the country's aim is within a span, working with the ICG group that I said, wherever we feel that there's a risk that there has been a confirmed outbreak, we will respond with vaccinating.
Okay. So for now, the other means, which is the preventive measures, are still going on side by side, but this is key for you because there's a strong outbreak here. Okay, I know people say, okay, it's just one of those vaccines, government is, let's drum out the danger in yellow fever running down the nation. Can we let the people know?
You know, if we go back 2 years ago, we had the big outbreak in Africa, basically around Congo and Angola. And this is an outbreak that, like, you know, it's mosquitoes, so I mean spread is quite easy if you have a population that is not protected. So you are talking of people who get infected within a span of 2 weeks or so, come down, the fever is there. Sometimes the yellowness is basically as a result of breakdown of blood cells. So you now start having all sorts of other systemic effects. It affects the kidneys, you know, it affects the sensorium and things like that. So outside looking at yellow fever as a health issue, we can also look at yellow fever as an economic issue, because when you have an urban outbreak, take for instance, and well, it's not something that we'll want, if you had a yellow fever outbreak in a big city like Lagos, or Kano, the health facilities will not even be able to address. So it basically shuts down the economy of the country. And when you look at the effect, and all you have to do to prevent it is just get vaccinated, I think we must look at that side. So there are huge issues that we will lose in the event of having a propagated outbreak, from an individual point of view, from a community point of view, as well as a nation.
Okay. Then tell us more about what other things are being done, because earlier on we talked about not having enough hands. I don't know if, well, maybe that's the struggle you talked about earlier, of health workers actually addressing the people's needs. How are we going about solving that? Or at least, especially in areas, maybe population more than some areas. What's the spread? How are we doing that to actually let everyone come on board?
There is general public awareness, because you cannot do it without the people. So the state is involved, the local government is involved, the communities, the ward, they are involved, and they have, inside the communities we have wards, and we have ward committee, development committees. All are working together to ensure that everybody gets vaccinated. And the National Primary Health Care Development Agency, World Health Organization, UNICEF, and any other partner that's interested, Affinet, they are there, the CDC, NCDC, they are there with them, monitoring, ensuring that everybody, every eligible group gets vaccinated.
So you're having personnel drawn from all these bodies? Drawn
from all these bodies.
Well,
they do right now, yes.
Okay, that's for
yes, for
but what about other parts where you have your preventive campaign going on?
The same thing. The same thing, yes.
Okay. And easy access for people?
Yes.
Okay.
Yes.
Okay. All right. I know we must go now, but if there are other means or other information that the public needs to know about what you're doing, might find time to actually look into that now, what to do. Okay.
Just also to add to that, because for us, every single time that these campaigns are done, we need to ensure that the quality of the campaigns are good, and to ensure that everybody is vaccinated. So for everybody who is vaccinated, we actually have cards given out to these persons.
Great.
So for just to be sure that you have been vaccinated. So it's not just verbally saying so, because people go around houses sampling people, asking whether they've been vaccinated. At the end of every campaign, we do what is called a post-campaign survey. Okay. So people go around randomly and ask whether they've been vaccinated with the card. So we're asking people, as you get vaccinated and you get issued those cards, please keep those cards with you, because in the next couple of weeks or so, we'll have people come out to actually do surveys to actually validate the quality of the campaign that we.
Yeah, well, good enough you remember to bring up that, because we've been told, there are insinuations that when people actually come around here, for those who likely want to go out of the country and they need to present such cards, people just find a way of, okay, get one health worker to just write me something without actually taking the shot. How dangerous is this for people who engage in such acts?
Without taking the shot?
Yes.
So the risk of that, if you was talking about that, maybe you looked at my card. If you look at these three, so there's something called preventing international spread. So if I don't get a shot and I travel, and I am carrying the virus, I could actually spread. As a matter of fact, the outbreak I was talking about in Angola, we actually had some Chinese migrant workers who we actually had the virus actually spread internationally. So one of those key aims is prevent international spread. So you will not travel out without the yellow card. And I think recently the federal government had also launched the e-yellow card, and there were all sorts of security things around the card, just to ensure that people only get that card when
anyway, I know yellow card is green card now, because I was issued a green one.
So just to correct, so whatever you were issued with, you still will need to get that yellow card from the ports held to travel.
So once you get to the airport, just present that and exchange that.
Exactly.
Okay, that's great.
Or from the Federal Ministry of Health. Yeah.
Okay, thank you very much, Dr. Tena Nwange. I have to keep remembering that. Accelerated Disease Control, World Health Organization. Thank you for coming on the program.
Thank you very much.
I'd also like to appreciate Nena Eze, public health practitioner with National Primary Healthcare Development Agency.
Thank you very much. It has been nice being with you.
Yes, very educative one you have given us there. Thank you very much. And that's Nigeria Today for today. We thank you for watching. If you can actually watch this particular edition online, and that's at www.youtube.com/NTA News 24. This edition or any other edition at all. My name is Blessing Abu. Enjoy the rest of your day.